right, and we're back with Dr. DeAnne Brooks, the Chief Pharmacy Officer at Cone Health, and she is talking about all things COVID and vaccine related. All right, so this question is, are there plans to reformulate the vaccines to make them more effective anytime soon? Seems like they don't work that well anymore, I guess because a lot of people who have been vaccinated are getting COVID.
Yeah, so the vaccines still work well in terms of keeping us as sick, but certainly those boosters do help to increase that immunity. And this is what happens with vaccines, many vaccines over time. There are new variants that come into play, and our antibodies and our immunity just simply decline. So the manufacturers are working to potentially reformulate, but I don't think there's going to be any reformulation really soon. So it's important right now, if you're eligible for a booster, to go ahead and get one rather than wait for a new reformulation.
And so right now, you're eligible for a booster only if you're over 50?
No, you can get a booster if you have received your 2 series. Greater than 50, you can get a second booster.
Okay, but okay, so under 50, only 1 booster, not the second one as of yet. Okay. All right, so this next question is, how long should you wait to get a booster after having COVID?
Okay, so it's recommended for the booster to be at least 5 months after that second dose of vaccine. Your body will have a boosted immunity to COVID-19 after being infected for up to 90 days. So you could conceivably get your booster if it's been that greater than 5 months, but it wouldn't, you could wait potentially for 90 days to get it.
Okay, gotcha. All right, so the next question is the Pfizer shot better than Moderna for kids because it has that extra shot?
Not necessarily. As a matter of fact, it depends on the studies that were done and what was reviewed by the FDA and the CDC and the independent authority that looked at that. And it's very possible that Moderna could have a third shot once some more studies are reviewed. So it doesn't mean that one is better than the other.
Okay. This person is asking, does someone's risk for COVID complications increase if they get infected several times?
That's a great question. And I haven't seen any data to support that the more times that you get COVID-19, your risk level is higher. But I would still continue to get the boosters as they're recommended, but I haven't seen any data on that.
You worry if you get it over and over again. I can imagine this person is thinking to themselves that, am I going to have some residual effects more than someone else who did not get COVID more than once or whatever?
Yeah, there's definitely the possibility of long COVID symptoms. I'm just not aware that there's anything in particular that says the more you get it, the more you may have some of those long symptoms.
This question is about the child vaccine, and it says, how protected is a child between the second and the third Pfizer shot? I'm worried that my child will get it in between those 2 months.
So each time you get the vaccine, your body is going to get a little bit more of the immunity, and then you get full immunity within about 2 weeks of the last dose. So in between the second and third, they're at a higher risk, but not as high as between the first and the second.
The next question.
They're at a lower risk between the second and the third.
Do we know yet if the COVID shot will become nearly like the flu?
We don't know for sure yet. It's very possible. It's a virus that changes frequently. And I know there have been some things out there on the newsreels that talk about that and certainly studying it. So it's a possibility, but it's not something that we have the full data or authorization for right now.
So this next question is about treatment for COVID. This person says, how do I know if I'm eligible for a COVID treatment like Paxlovid?
Yeah, great question. So if you test positive, You should always contact your primary care provider and let them know that you have tested positive, and they can let you know if you might be eligible for the treatments like the Paxlovid. The other thing that you can do is call your local pharmacy that has the Paxlovid, and they can also walk you through what the guidelines are to be eligible for that therapy.